Well, thank you all for joining us. I'm Rob Lott, Deputy Editor at Health Affairs, a multidisciplinary journal dedicated to exploring health policy and system change. And I'm delighted to be your moderator today. To Michael, Yi-Ching, Buff, and the whole team at Philanthropy New York, thank you for bringing us here. And thank you again to Donald Jonas and the Jonas Family Fund for your support. So why are we here? Why the healthcare workforce and why now? Well, the title of this event describes a healthcare crisis. It's true, we know there's great urgency to the challenges we face in shaping the healthcare workforce of tomorrow. There is our rapidly aging population. There are increases in chronic illness, mental health needs, the rising number of newly insured patients seeking care for the first time, and certainly the limits, both economic and regulatory, in how we can effectively and quickly grow our health professions pipeline. These are big challenges that we must not wait to confront. Yet, despite such enormous challenges, this moment also offers some very powerful opportunities that have all begun to coalesce in recent years. There's the large-scale implementation of health IT, which despite very sharp growing pains has begun to connect clinicians, patients, communities in profound ways. There's the aggressive push across the entire healthcare system to focus more on value, less on volume. And there is a growing understanding and recognition of the importance of prevention and the idea that much of people's health is shaped by what happens outside of hospital and clinic walls. All of these trends are changing the way we think about attracting, training, and retaining the next generation of health professionals. So for today's discussion, I hope we can ask not only how to confront the big challenges standing in the way of a 21st century healthcare workforce, but also how do we seize these opportunities? Fortunately, we've got the right people here to help us answer that question.
The strength of America's health system today include a strong scientific base due to public and private investments in biomedical research and development. In spite of this, we as a country lag many other Western nations in the health indices of our population. Health behavior of our citizens, as well as lack of health insurance in a significant portion of our population. But another factor has been the number and the diversity of the nation's healthcare professionals.
Well, I just think this might be a good time for us to think a little bit about the members of Philanthropy New York and funders, and maybe, each of us might like to say what we would like them to fund.
I would like to see more dollars available for scholarships so that students will be less encumbered by the necessity to reduce debt burdens.
The John A. Hartford Foundation is very focused on better care for older adults, and specifically 3 areas are supporting family caregivers, working with people who have end-of-life serious illness and all of the ramifications and choices and patient-directed thinking that goes into that. That's not just geriatrics. We happen to focus on older people, but anybody can join that momentum, which I think is very exciting. And then finally, a new initiative on age-friendly health systems, which is what we call a heavy lift. And we're just working with the Institute for Healthcare Improvement to get rapid PDSAs going, and so that we can get spread and scale. And I welcome all of you to keep asking us hard questions about that one. So, thank you.
I think that we have a national long view, and we have a foundation that's essentially really taking lead in a major area. My vantage point on just a day-to-day basis is slightly different at the moment. I interact with new vibrant generation of medical students, and what I'm really most concerned about is the norms that they develop, what they see as the defaults in their environment, because we haven't actually changed yet. We aren't in the new world. And so if they have these 12-year training paths, they come out of it, and they've learned into defaults, how are we going to move forward? We're going to be tripping over our own shoelaces as we try to walk forward. What I'd really like to do is support our medical students in being able to partner with groups that are taking excellent, innovative, well-designed approaches to workforce, spending time in those settings, maybe just during their summers, or potentially abroad in targeted settings where they can see what is the new normal, what does the future look like. And I love that phrase of, the future is here, it's just distributed unevenly.
Yeah.
And, we are in, a city that is entrenched, in how we do things in some degree. And I would love to partner and work with groups that care about the attitudes that are being the defaults of the next generation of people, so that we don't have a conversation in 40 years that says, we've kind of made a little bit of progress, that that we've still got the same guilds, we've still got the same pressures. It's something I'm really passionate about, and I know that our students are too, because they've come down from different backgrounds, and they're starting to say, why is this the norm? I hope they keep on asking that question instead of saying, well, it is because probably was supposed to be like this.
As funder, I would just say that for other funders, look to those who have already done a project and find out everything you can from them. When I first started in philanthropy, I realized that many of the funders were funding a project, and 2 miles away, there was another $2 million project that was exactly the same. And we just don't have that kind of money in our system, and philanthropic organizations don't have it. We cannot waste those funds. And so I just find out if someone else is doing it, call them, find out everything you can about it, what was good, what was bad, and move it to the next level. Don't do it again if there's data and information there. And if you want to work on a project, find someone who's already doing it and see if you can partner with them so that you can use their knowledge, just add your money and resources and passion to it and advance it that way. We all don't have to start at the very beginning.